Is St. Lucia's declining birth rate an economic red flag? If the future promises fewer workers and more retirees, that could spell problems for the current generation of workers when they retire in 2 decades. What will be left for them if there are fewer productive adults to contribute to national insurance? The Health Minister, Moses Baptiste, admits that this could be a serious concern.
The declining birth rate in St. Lucia, of course, is of concern to us. It's of concern because when you look at the future of the country and you think about the pensions, you think about our social services and how the productive capacity of the country over time will be impacted with the declining birth rate, of course it is of concern.
Regardless of whether the birth rate continues to decline or not, the equipment, pharmaceuticals, and expertise demanded by our population for healthcare is imported and bound to get more expensive. For that reason, St. Lucians are reminded that prevention is better and cheaper than cure.
A lot of the cost in healthcare actually comes from imported services, professional services, pharmaceuticals. It comes from equipment. A lot of most, if not all of the equipment we do not produce in the Caribbean or in the sub-region, and so we have to import if you have inflation. So a lot of the costs in healthcare, it is difficult for us to control the costs. Where we have the advantage is really in the whole area of prevention. And if we can continue to work with agencies and organizations, families, and the whole society to cause there to be more awareness about health prevention and health promotion, then over time we can see that impacting the cost of healthcare, especially at the individual level.
The minister reminded the nation that St. Jude's Hospital will be completed and reopened in the very near future, bringing domestic access to health to higher levels than ever before.
We'll continue to tell you, the Prime Minister has announced that the St. Jude Hospital will transition this year, and we know that the works are at a very advanced stage, and we look forward to the transitioning of the St. Jude Hospital.
Primary health care has been promoted in St. Lucia, making tests and risk assessments better accessible to local communities on island. The government is also incrementally rolling out a universal healthcare program that is already relieving mothers, newborns, and the elderly of many burdensome costs. However, the behavioral changes in diet and lifestyle remain the top factors that can lead to a decline in healthcare costs and a stronger economy. For Choice News Now, I'm Sienna Dalto.